Hello, class. So, the topic that I chose for my term paper was Alzheimer's disease and music therapy. Alzheimer's disease is both progressive and fatal. Progression of the disease leads to memory loss and overall cognitive decline. The causes range from advanced aging, degeneration of anatomical pathways, environmental factors such as exposure to toxic elements, head injury, vitamin deficiencies, genetics, mitochondrial dysfunction, a compromised blood-brain barrier, compromised immune system dysfunction, and infection. At the present time, there are drugs that may delay the advancement of the disease, but there is no treatment that can prevent, cure, or reverse the symptoms of Alzheimer's. In the absence of a cure, all beneficial treatments and therapies that show efficacy are worth exploring. Alzheimer's disease patients who have participated in music therapy show benefits in the areas of memory and cognition, stress and anxiety reduction, improved sleep, and better socialization. Some of the best memories of the human experience are tied to songs. Music therapy is low cost, has no side effects, and is fairly easy to implement. The incidence of Alzheimer's disease will correspond with the trend of the longer lifespans. Incidence of Alzheimer's for people 60 to 64 years old is 1%. This number jumps to 24 to 33% beyond the age of 85. As of 2015, the average cost of care for someone with dementia, the cognitive decline associated with Alzheimer's disease, can be over $320,000. MRI imaging shows that Alzheimer's disease affects the hippocampus and entorhinal cortex size, which leads to diminished memory, trends towards mild cognitive impairment, and Alzheimer's dementia. Music may activate neural networks that are not damaged in Alzheimer's disease. There is reason to suggest that musical memory regions of the brain are mostly unaffected by Alzheimer's disease, and this may account for the efficacy of music therapy to aid in verbal and musical memory access. The first studies of the effects of music therapy on Alzheimer's patients took place from 2 different nursing homes in suburban Philadelphia, 12 participants symptomatic of Alzheimer's disease and scored 20 or less on the mini mental state questionnaire. The MMSQ was given before and at the conclusion of the study to assess cognitive function. 4 groups of 3 met 6 times. Sessions were 30 minutes long, comprised of 2 of each type of session: musically cued reminiscence, playing songs that were familiar to the participants and related to events and areas of their lives. Each song, participants were prompted to relay information about the lyrics and what they were describing. Participants also attended verbally cued reminiscence sessions, where they were simply asked questions prompting discussion in order to encourage recall of memories and details of their lives. They also attended music activity sessions without any specific cues. The same songs as the musically cued reminiscence sessions were used. The researcher simply observed without leading the session in a specific direction. Some notable results of this early study were the observable reduced anxiety of these participants in the presence of music. Overall, through the course of the study, their MMSQ scores improved. Tying questions and recall to the songs from an Alzheimer's patient's life was significant in the study and something to be replicated in further studies. The need for further research and a larger sample size is definitely established in this initial study. Another more recent study that took place in China involved a focus on active music therapy. Participants in the active music therapy group um, would sing the favorite songs of their 20s and 30s, songs that had calming properties. A second group would read the lyrics to these songs with no musical accompaniment, and a third control group would have no therapy. Assessments were done before the start of therapy, after 3 months, and 6 months. Notable results from this study were within the singing group, patients with mild Alzheimer's scored statistically significantly higher than the other groups in the areas of immediate and delayed recall. The singing and lyric reading groups showed significantly higher scores in verbal fluency than the control group. The singing group scored significantly lower on neuropsychiatric inventory. Basically, lower scores indicated less severe psychiatric symptoms. Decreased psychiatric severity occurred in mild, moderate, and severe Alzheimer's patients. The decreased psychiatric symptoms coincided with better daily functioning and less stress for caregivers. There have been notable observed positive relationships between elevated testosterone levels and elevated cognitive testing scores for aging males. Hormone replacement therapy has been used for better cognition, although this type of therapy carries risks related to cancer, heart disease, and stroke. There's also been an established relationship observed between listening to music and testosterone and cortisol levels. Another study that I researched involved 6 female participants, 67 to 90 years old, with Alzheimer's, music therapy sessions, singing of 12 carefully selected songs by the therapist, accompanied by keyboard, and each session was an hour long. Salivary samples were collected before and after each session. In total, 36 samples were collected, indicating the results after 18 sessions. Results of note from this study were the increases in 17B estradiol and testosterone levels. These hormones were chosen in response to information suggesting that they prevent damage to neurofibrils which occur during Alzheimer's disease. The study highlights definitive physiological changes as a result of music therapy participation, elevation of essential hormones in prevention and treatment of Alzheimer's disease. Poor sleep is a significant problem for both Alzheimer's patients and the aging population in general, and music therapy has shown concrete results in increasing serum melatonin levels, which leads to higher quality sleep, and improved sleep hygiene can be both preventative and prescriptive for the cognitive deterioration of Alzheimer's disease and the elderly in general. In conclusion, music therapy for Alzheimer's patients can promote physical activity, mental exercise, stress management, better sleep, and socialization. Notably, the active forms of music therapy that involved singing songs provided a more engaging experience, which produced additional positive returns. The inclusion of songs from the lives of the participants reinforced episodic memory in these patients. Any strategy that can improve the quality of life of Alzheimer's patients is worth exploring, and even modest gains should be seen as significant wins.